The U.S. Department of Health and Human Services bringing back a long disbanded task force on childhood vaccine safety. The panel's new mission: recommend ways to reduce adverse reactions and strengthen safety monitoring. In a statement, the director of the National Institutes of Health said, by reinstating this task force, we are reaffirming our commitment to rigorous science, continuous improvement, and the trust of American families. The move has been backed by anti-vaccine activists, and critics say it's inviting more vaccine hesitancy and misinformation into the department, and that could fuel more public doubt. Here now to talk more about the move and the rise of anti-vaccine sentiment in America is Dr. Daniele Fallin, Dean of the Rollins School of Public Health at Emory University. Welcome to the show. Thanks for the time.
Thanks so much for having me.
All right, let's start with your take on the HHS's move regarding the Childhood Vaccine Task Force.
Yeah, I mean, I'm a parent. We all want our children to be safe. We in public health, probably more than all the rest of us, because we wake up every day thinking about how we can improve the health in our communities. And so, and we're really proud of the vaccine infrastructure that is put in place in this country, which already is incredibly rigorous and has very robust safety monitoring. And so a new task force, or the reinstatement of this task force, sows some doubt whether or not we were already doing that kind of rigorous approach. And so that worries me, because that is not the case. We really are the safest system in the world.
We often hear about vaccine hesitancy versus outright opposition. How important is it to make that distinction when talking about public health strategies?
Yeah, I think, again, a focus on safety is always a good idea. The distinction between hesitancy and changing vaccine schedules or removing vaccines is a slippery slope. As you start to sow any hesitancy, we can see decreased vaccination rates and increased suffering from preventable illness.
Let's talk more about that because there is an impact that goes beyond someone's personal choice. It goes into our communities. Fewer people getting vaccinated has those wide implications. Diseases that were eradicated, we're seeing that with a resurgence of the measles, for example. 6 cases in Georgia, more than 1,300 confirmed across the U.S. Talk about that impact and what you feel is the most important message in that vein.
It's really disappointing to see our vaccine rates go down and our increased rates of preventable disease, which can lead to hospitalization and, unfortunately, in some instances, to death, when we have the tools to prevent these illnesses and this suffering. And we're really proud of that infrastructure and that accomplishment in public health.
From your perspective, what are the biggest factors you see fueling anti-vaccine beliefs right now? Is it maybe misinformation, political climate, historical mistrust, a combination of all of that, or is there something else here driving that?
I think we know that vaccine misinformation, or siloing of information so that folks don't have the full set of information to make the best choices for their families and for their communities, is harmful. It's harmful in our increased vaccine preventable illnesses because of decreased vaccinations. And it's harmful in this kind of fueling what might be antagonism against the public health workforce and our healthcare workers.
Yeah, we're coming off the CDC attack in Atlanta. Investigators link the gunman's motive to vaccines. Given the political and the cultural polarization around vaccines, what do you think the next decade of public health messaging will need to look like?
I think it's important that we all admit that we can do a better job of communicating useful information in our communities. And so we at our school and at many places across the country are really leaning into better skills development and communication. But it goes beyond that. It's really about dialogue. It's about listening. So not so much telling people what they should be doing, but rather asking what's important to the health in your community and how can we work together to do that. And that kind of de-siloing and conversation making, I think, will be critical to the success of public health moving forward, which means to the success of our society moving forward.
You know, it's interesting. Some people argue that engaging directly with misinformation gives it oxygen. Others say ignoring it just lets it spread unchecked. You're saying that conversation is key here.
I do think conversation is key, and I wouldn't characterize it as engaging directly with misinformation. I would characterize it as engaging directly with people. We are all people in our communities who want to be healthy. So let's talk through what are the things that might lead to siloing and only getting a certain amount of information, and how can we expand that so that people can have all of the correct information they need.
Yeah, if someone has a concern, talk through that, get the information. No dialogue means no movement. And maybe that's the hardest place to be. So given the political and cultural polarization around vaccines and those conversations that need to keep happening, if you could implement one nationwide initiative tomorrow to rebuild trust, what might that look like?
Let's have community conversations where we bring folks who have very instilled belief systems when it comes to some issue of public health, talk to each other in a judgment-free, active listening situation, and let's see if we can find ways to have common ground amongst our fellow humans.
I think sometimes the simplest things are the most important answers. Dr. Daniele Fallin, we really appreciate the insight and your experience and the time today. Appreciate it.
Thanks so much.